Good afternoon, everybody. I'm Governor Roy Cooper. I want to welcome the people of North Carolina who live in communities across our state who've joined us today to learn about the state's response to the pandemic and what you can do to help yourself, your families, and your neighbors. First, I want to congratulate you. The people of North Carolina have been working hard over the last couple of months. We've been staying at home for the most part. We've been looking out for our neighbors, trying to stay socially distant, learning those new things that we have to do to protect each other. And consequently, we have flattened the curve in our state. We have not had the peak of illnesses and deaths like we have seen in some other states and across the world. So I'm thankful for that, and the credit goes to you. We're relying on science and data to tell us when it is time for us to try to reignite our economy, try to let people do more in and about the community. I know a lot of people are hurting right now. Some families are hurting from sickness from this disease. Other families have experienced job loss, your business being hurt by this pandemic. So what we've been trying to do is, number one, try to make sure that everybody has medical treatment if you get COVID-19 and that we have enough hospital beds, ICU beds, and ventilators to do that. Secondly, we've been working hard to slow the spread of the virus. We know that we can't stop it until we get a vaccine, but we can slow the spread, and people have worked hard to do that, and we put restrictions in place to help do that. Third thing we've been trying to do is cushion the blow to the economy with funneling federal and state money, helping people with unemployment insurance benefits that you'll hear a little bit more about today, help for small businesses, and we're working very hard to help local governments as well. Yesterday, I made an announcement that our objective indicators that we look at, the data and the facts, tell us that we can now enter phase one. It's important to note that in phase one, the stay-at-home order is still in effect. However, you can go and do more things. We've removed the essential, non-essential business designation, and now many businesses can be open, and you can leave home to search for or obtain goods and services with those businesses. Still, as in before phase one, things that cause close contact and we're worried about the spread of a virus are still closed, like restaurants, which are closed. Only you can get carry-out and delivery. Bars, gyms, pools, theaters, those kinds of things where you have close contact, they're still closed. And still, we're prohibiting gatherings of more than 10 people because we've seen the virus viciously spread in those ways. We're also telling businesses that it is important to protect your customers. You know, we're not going to boost our economy until people have confidence in their safety. And we want to send the signal to people that businesses are safe and that you can patronize them. And what we're telling people when they leave their homes to remember the 3 W's. Number one, wear a face mask. Now, or face covering. This is mine that I have been wearing when I'm at the EOC. It is from Raleigh Denim, and people are getting creative about their cloth face coverings. But that W is important, not as much for yourself, but for other people, because the mask prevents you from spreading the virus if you have it and you don't know it. The second W is wait at least 6 feet from each other. It's important to keep socially distanced. And the third W, wash your hands. Cleanliness is so important. Really grateful to all of the people who are coming together and doing this. This new phase one starts on Friday. It will allow you to do more things, but we want you to be safe. You're going to hear some great information today from people who are going to provide some things for your family to learn, things about that you can learn about state government. You can go to NC.GOV/COVID19, and you can see all the data and facts that we're relying on to make these decisions. I'm honored to serve as your governor. I'm going to keep working hard every single day to get us through this pandemic. Together we can, as long as we can depend on each other. I pray for everybody's safety. I want to thank you all for tuning in today. See you soon.
Thank you, Governor Cooper. And thank you all for joining us this afternoon. My name is OKIRAH Harris. I serve as the Assistant to the Director of Public Engagement at the Office of the 75th Governor of North Carolina, Governor Roy Cooper. This is our 8th weekly webcast, and today we will focus on unpacking important changes regarding the North Carolina stay-at-home order. We encourage you to engage with us via the YouTube stream or the WebEx chat room, where you can submit questions real time. There are epidemiologists standing by to answer any health-related questions you may have, as well as government agency professionals to answer any leadership questions you may have. During our program today, we will hear from Mr. Benjamin Money, Deputy Secretary from the North Carolina Department of Health and Human Service, Ms. Caroline Farmer, Director of the Office on Volunteerism and Community Service, and Mr. ANTWON Keith, Chief Deputy of Programs from the Department of Employment Security. We will wrap up our program with Mr. Jeremy Collins, the Director of Public Engagement, who will be addressing questions you've submitted during this program. I want to thank everyone for being here today. We also encourage you to visit the North Carolina Department of Health and Human Service website at NCDHHS.GOV/coronavirus, where you can find additional resources and information. With that said, I invite Deputy Secretary Benjamin Money to the stage. Thank you.
Thank you, OKIRAH, and good afternoon. As the Governor just mentioned, on May 5th, he modified North Carolina's stay-at-home executive order, transitioning the state to phase 1 of slowly easing COVID-19 restrictions. Executive Order number 138 goes into effect on Friday, May 8th at 5 p.m. As I've said on numerous occasions, social distancing is our best strategy to protect ourselves from the pandemic and flatten the growth curve of COVID-19. We know that there are people that have at least one underlying health condition that puts them at higher risk for serious illness. These represent 27% of North Carolinians between the ages of 18 and 24, 36% of people between the ages of 25 and 49, and 49% of the people between ages 50 and 65. And for those folks over 65, it's 56% are also over 65 and have an underlying condition. So it's not just risk in folks that are over 65, but this risk exists across all ages. We need to keep this in mind as we move forward. These are our most vulnerable citizens. As we move slowly to ease restrictions and modify the stay-at-home order later this week, it's important that we cannot lower our guard. So, as I mentioned last week, we're really focusing on 3 T's to guide our efforts. That's testing, tracing, and trends. So let's talk a little bit about testing and give you an update on where we are. So when I gave a presentation 2 weeks ago, we were actually doing half the amount of testing that we're doing right now. We're twice as much in terms of testing. And we have active plans underway to increase testing even more across the state. So that's our first T, is testing. Second T is tracing. When we announced contact tracing employment opportunities last week through the Contact Tracing Collaborative with CCNC and North Carolina AHEC, we had a goal of hiring 250 contact tracers. Thus far, in just a week, we've had over 4,000 applicants for those positions. And the first class is going to be trained and deployed by the end of the month. So we're moving very quickly on that second T. So both of those T's are heading in the right direction. Third T, the most important T, is our trends, our metrics. And remember, science is going to determine how we move forward in our process of addressing this pandemic and efforts to ease restrictions that we've put in the state. So we'll continue to look at the trends of COVID-19-like syndromic cases. So in other words, those cases that are like COVID with the same symptoms that show up in the emergency room. We also look at lab-confirmed cases of COVID-19. And then we look at positive tests as a percentage of total tests. And then, obviously, hospitalizations, as the governor mentioned, to make sure that we're not in a position where our healthcare system is going to be overrun. So what we're seeing right now is good movement in these trends. We aren't seeing significant downward trajectories on most metrics, largely because we were successful in preventing a sharp peak. So as we flatten the curve, the movement downward is not as pronounced, and that's a good thing. So we look relatively stable on these metrics. But it's also important that we can't look at these metrics in isolation. So as we talked about increasing our testing, we're looking at the percent of positive tests. And what we're seeing is that's going down, even though the overall number of cases is increasing. That's a good sign. So if we're testing more people, but the percent of positives is going down, that's the right direction we want to be in. And then we're also tracking the day-over-day hospitalization. So at every day, how many people are in the hospital? And what we're finding is that that's also largely level, meaning that hospitals have the capacity to meet increased demand if more people become seriously ill. That's also a good thing. So we're showing stability. But we're also cautious as we ease restrictions. We want to make sure that we keep these trends stable and going down. Again, health and science are driving, when we open, our businesses, our civic organizations, and our stakeholders are having the input. So science is driving the decisions, the input's coming from those stakeholders. So I want to just outline a little bit about what phase one means. And the governor talked about the fact that in phase one, any retail business may be open at 50% capacity, and businesses will be required to practice social distancing, perform frequent cleanings, provide hand sanitizer when available, screen workers for symptoms, and more. Also, people may leave their homes for commercial activity at any business that's open. But it's important to remember, if you don't have a need to be out, please remain home, because that social distancing is still our best prevention until we have a vaccine. Also, certain businesses are going to remain closed, as the governor mentioned, including bars, personal care businesses, entertainment venues and gyms, and restaurants may only continue to serve customers for drive-through and takeout and delivery. We're still encouraging telework where possible for businesses that can practice it. And as the governor mentioned, face coverings are recommended when you leave the house and may be on near other people who are not family members or household members. So it's important, if you're coming in contact with people that you don't live with, have that face mask on. I want to also make you aware of the fact that our website at www.NCDHHS.GOV has created several materials to help businesses navigate phase one, including a checklist for business owners, interim guidance for owners, staff, and patrons of all businesses that are open, a symptom screening checklist, as well as templates to meet your required signage. So Governor talked about another triplet of letters to remember, the 3 W's. So it's important as we move into the next phase to remember: wear a face covering, wait 6 feet from other people, and wash your hands often. And remember, if you don't need to go out, please stay at home. Remember your 3 W's, and remember the fact that we've gotten this far because of your concerted effort. Your effort at staying home, the sacrifice that you've made, has led to the success that we're having in flattening the COVID growth curve. Keep it up. Please keep it up. We can't afford to let our guard down now. Thank you. And at this time, I'd like to invite Carolyn Farmer to come up and give us an update on volunteer opportunities. Carolyn?
Good afternoon. My name is Caroline Farmer, and we're on the Commission on Volunteerism and Community Service in the Governor's Office. Before this pandemic, I'll be honest, I did not know how to add a call on the iPhone. The little plus symbol, I had no concept of what it was for and didn't even bother to look. And then because of this, I have learned about how to use the iPhone more thoroughly. I have learned about WebEx. I've learned about Zoom, Google. It has been a wonderful way of making sure that we are connecting with our community, that we are still meeting and we're still engaged. Now, with this new phase 1 coming, not a lot changes as far as volunteerism. You're still going to be able to do volunteerism like you have in the past. But I want to raise a few things. First of all, use those new skills to start bringing together groups in your area, to start talking and having the dialogue about what the community is going to look like when we're through the phases. Now, you're going to hear from ANTWON in a little bit, and I will tell you that unemployment numbers are still on the rise. They will continue to be on the rise. And as such, we need people locally to be thinking about how they can better do career counseling for those people in their community that need additional assistance to become reemployed. I want you to research it and look online, make calls, have community meetings virtually. The second thing I would say is food is going to continue to be an issue. It's an issue right now. We've even had to get the National Guard to go help out at the food banks because the demand is so high. We need more help. Your local food pantries, every day, we are hearing about food banks and food pantries that need more assistance. In fact, last week, some of my friends celebrated a birthday party by working at our local food bank. So if you notice, everybody has a mask on, is wearing gloves, and is 6 feet apart. It is a way to see your friends. It is a way to socialize. It is a way also to make sure that you are helping your community. So please consider continuing with that. We also want to make sure that you know about all these opportunities. If you have not already been to Volunteer.NC.GOV, I want to make sure that you know about this. We have the information there. Every day we get a new pantry that needs help, or Meals on Wheels that's about to not be able to deliver. We have a group, just a few counties down east, that delivered 15 meals before this started and is up to 150 meals now. They can't deliver anymore because of the fact they don't have enough volunteers. So there are needs everywhere. You just need to look. And if you have questions, go to the website. There, our contact information is there. Along those lines, there are masks that people need. Now, my mask is boring. It is nowhere near as cool as the governor's is. I've seen some gorgeous masks out there. Mine is boring because I've been working and not sewing. So I want to encourage you to talk to your teenagers and make sure they understand that the masks are needed when they are at the grocery store, when they're running to the department stores and so forth. So please communicate about the mask and sew at home. We have lots of entities that still need help with masks, and so sewing at home is still needed. And then the last thing I wanted to say was mental health. You know, there's still a lot of people who are anxious because they don't have jobs. There are a lot of people who are upset because they're isolated and they feel depression. I want you to look at being able to help some of those folks. coronacommunity.org, encourage folks that you know to sign up so they can get well-check visits, just a regular call from somebody to check in on them and just talk about everything that's going on. So there are resources out there. Those are also available on our website to make sure that you can help those folks who need it. So on that note, I encourage you to stay committed just like you have before. If you're getting out to run more errands and do more non-essential businesses, I would encourage you to also volunteer. And on behalf of the governor, thank you very much. ANTWON is next.
Thank you, Caroline. Hello all, my name is ANTWON. I'm with the Division of Employment Security, and I'm going to take a moment today to talk a little bit about unemployment insurance in the state of North Carolina. We'll talk about the good, the bad, the ugly, and the myths. The good. In the last 7 weeks, we've taken over 1 million claims, paid out over $1 billion in federal and state funds. We're one of the top 15 states in the nation to begin paying the extra $600 provided in the CARES Act. And we're one of the top 15 states to begin paying the Pandemic Unemployment Assistance, or PUA, which is benefits provided to the self-employed and the 1099 crowd that were affected by the coronavirus. Currently, we're in the process of programming the Pandemic Emergency Unemployment Compensation, or PEUC, which provides an additional 13 weeks of benefits for those who have exhausted their regular UI. We began testing that code this week. We will know in a few days an actual go-live date, but as of right now, we expect to send that up within the next 2 weeks. The myths. We've taken over 1 million claims, but that doesn't equate to 1 million individuals filing for unemployment insurance, because you can have individuals who file multiple claims. Currently, we've had just over 800,000 individuals file for unemployment insurance in the past 7 weeks. We have paid just under 460,000 of those individuals. The extra $600 is only payable for the weeks between March 29th and July 25th. You only receive that extra $600 when you're entitled to at least $1 of unemployment benefits. So if you're working part-time, if your hours have been reduced, you report your gross earnings each week. If you're entitled to any amount of unemployment insurance, you get the extra $600 on top. If you report your earnings and it's more than your entitlement, you will not receive the extra $600. The PUA. The PUA is only for individuals that became unemployed directly related to COVID-19. If you simply cannot find a job due to COVID-19, you're not going to be eligible. And you must not be eligible for any regular unemployment insurance or extension. The extra 13 weeks. The extra 13 weeks is provided to anyone that is filing for unemployment insurance, regardless of what the reason is for you being out of work. However, it is only payable during the time frame between March 29th, 2020 and December 26th, 2020, only for those particular weeks. The one big thing that I want to implore upon you is the weekly certification. You always do a weekly certification if you're filing for unemployment insurance benefits. The weekly certification is the instrument that puts your claim in motion. The only time you stop filing that weekly certification is if you have decided you are no longer filing for unemployment insurance. The bad. No one envisioned we would have a day when we're taking 20, 30,000 claims on the same day, in the same hour, at the same minute. It has been a tremendous strain on our systems, and we have had to add capacity across the board. We've had some things that have been outside of our purview, though. One of them being, we've run all of our claims through the Social Security Administration to check for potential fraud. The Social Security Administration has been overwhelmed by all of the states sending those claims through. We used to do a real-time interface. We've had to disconnect that real-time interface and do a batch upload in the evenings. It sounds like it's okay, but what that does is it creates downstream problems. And one of those downstream problems is individuals that have pending status for their claim. Those pending status means that the system had to treat this as potentially fraudulent, so we have to touch these one by one. We have the real-time interface back in pocket now, but we still have those pending status that we are working through. We have added staff. We have repurposed staff to help with this issue. We've had similar issues with other national systems that we use. The ugly. Prior to this global pandemic, we took around 2,500 to 3,000 claims per week. As I stated previously, we've taken over 1 million claims in 7 weeks. During the worst times of the Great Recession, which was 2009, we took 1.2 million claims for the whole year. The call center traditionally will take from 40 to 50,000 calls per month. When we had Hurricane Florence back in 2018, they were taking 100,000 calls per month. Currently, we're taking well over 100,000 calls per day. It has really overwhelmed our system. We have worked with our State Department of IT to change our phone platform since our old platform was so antiquated. We've contracted with an outside call center to help take the calls. We've trained them and continue to upgrade their training so that they can handle more and more types of calls. As you know, it still takes time to get ramped up to be going at full speed. We continue to add staff. We continue to try to open up that pipeline so you can get in touch with us. In addition, this week we added a chat function to our services. We continue to scale that up, improve the functionality, and fine-tune so that it can be better use to you to respond to your questions. In summary, I know this isn't the best situation, although we are better off than many states. We have a solid trust fund. We don't have to worry about borrowing money from the federal government and possibly passing that cost over to employers, which many states are actively looking at right now. Governor Cooper has waived employers being charged for these COVID-19 related claims. The governor has also waived individuals having to do a work search during this unprecedented time. But the phone lines are jammed, and we're addressing it as quickly as possible. We will continue to work 10 and 12-hour days. We will continue to work Saturdays and Sundays. We have worked holidays. We will continue to push hard to get these claims squared away. I cannot promise you that this situation is going to get easier today, tomorrow, but one thing I can promise, if you're due unemployment insurance benefits in the state of North Carolina, we will get you your money. Thank you.
Good afternoon. My name is Jeremy Collins, Direct the Governor's Office of Public Engagement. First, I want to thank all the presenters and participants this afternoon. First, the presenters, Governor Cooper, Ms. Harris in my office, Ben Money from the Department of Health and Human Service, and Caroline Farmer, and our new friend, Mr. Keith, ANTWON Keith from the Department of Employment Security. And I want to thank all of you who are participating online right now. We've heard many of your questions. First, we want to be just really mindful of where we are. It's a burdensome place to be in a new territory that we have never covered before. But it's a blessing for us to be able to share information with you at such a difficult time. On behalf of Governor Cooper, we want to make sure that you're well aware that not only are we walking in this space with you, but that we're here to serve. I've heard a lot of comments about what does phase one mean as far as going back to work, and what does phase one mean as far as entertainment. There are several resources. You can go to our website where we've listed all the executive orders and all the guidance along with that. That website's governor.nc.gov. Again, that website is governor.nc.gov. But I'm going to take a moment and just answer a few of the questions that came up on the chat today and that we've received since the start of this. One was, what happens, or what does it mean when a business or a local entity is in non-compliance with Executive Order 138? The executive orders are enforced by local law enforcement. And so if you are aware of a business, particularly a business that could pose a significant health threat, like a gym or a facility where folks are forced to be in close quarters, you should report that activity to local law enforcement. And I say that being as mindful as possible. I think the first thing you want to do is contact that business and make sure that they are aware of where we are at this phase one of the stay-at-home order, or in this effort to stimulate our economy, kind of moving ourselves out of this tightened restriction. But if it continues to be an issue in your community, you do want to contact local law enforcement. Our office, the governor's office, is not going to kind of deploy to a local community and walk in and shut a place down. The orders are explicitly to be enforced by local law enforcement, so that's your recourse there. Another question that came up on the chat line was, what does phase one mean for worship services? I believe the governor addressed this earlier, but I want to make sure we're really clear on this. We remain to encourage faith communities to gather no more than 10 persons, and when you do, socially distance. We encourage virtual worship. We do have an exception in our guidance for funeral observances. So if you've lost a loved one, or if you're attending a funeral, or if you are the leader of a faith community, a parish, a church, mosque, and there's going to be some sort of a funeral or memorial or celebration of life, we do give guidance for 50 persons, no more than 50 persons at one time. And so I'm aware that some communities are holding kind of smaller, multiple small memorials, and so long as you can get people in and out and clean and make sure that the surroundings have been sanitized, that is okay. But we are saying no more than 50 persons for funeral or memorial observances. But the current order does not change our guidance on worship activities. Another couple of questions we received today. What does this activity, what does phase one mean for museums? Many of you have asked if state parks are opening back up, does that also mean that state museums and maybe even local museums? In this instant, museums will remain closed through phase one. And so there will likely be some more guidance on that moving into phase two. But again, as the governor said earlier and was echoed by all the presenters, we are depending heavily on science and data to tell us when those types of businesses or types of venues will reopen. But at this point, entertainment venues will remain closed, and it's something that will likely be addressed in phase two. Same is with colleges and institutions of higher education. That question came up on the chat stream as well. Of course, there's a lot of distance learning happening right now. As many of you have seen, my daughter's in kindergarten, and she's got online classes every day or some number of days a week for a couple of hours, and it's keeping her enthralled in the rigors of kindergarten education. And we're seeing that in middle school and high school, and of course in college and our community colleges. So those facilities at this point will remain closed. As the governor stated yesterday in his press briefing, we are hopeful that many of our institutions will be able to reopen in the fall, but we cannot promise that at this point. We are still in a place where protecting public health means that we need to be physically distanced, particularly in those spaces where there are large congregant communities that people can be in close contact, and you don't have the opportunity to make sure you're physically distanced and can wipe down and sanitize things. So at this point, colleges and community colleges stay the same. I want to leave you with a few final points. The governor mentioned this. It was echoed several times today. Wear face coverings. I've got mine here. And if you need to put your hands on a face covering and you can't find one, send us an email. Let us know that you're a person who doesn't have any face coverings. I know that was, I'm probably going to, pull my hair out later on. What little hair I have, I might rub on it because I asked you all to do that. But if you need a face covering, we want to make sure we try to get you one. And you can email our office at OPE@NC.GOV. Again, the email address is OPE@NC.GOV. So wear a face mask. Wait 6 feet apart. Everybody doesn't know what 6 feet means. So stretch your arm out, double it. That should be about as far as you get to the next person. Stretch your arm out and double it. That way you know you're 6 feet. But again, physical distancing is the best way that we're going to beat this pandemic. Finally, wash your hands. Wash your hands. It amazes me that we have to say that, but wash your hands. Keeping the germs off yourself and away from your face is one of the best things that you can do. In addition to the W's, we need to be mindful of each other and mindful of our communities. And so if you know of persons who either are at health risk or pose a health risk because of their physical condition, make sure that you're attentive to your neighbors. It's not so much just about whether or not a person has COVID-19 or not. It's really trying to make sure that everybody in our society is healthy. And so if we can create opportunities for people to access health care, whether it's a free and qualified or federally qualified health center, or making sure that someone has access to telehealth, or that they know about medications, any information that you receive that we can distribute to marginalized or underinsured populations, let's make sure that we're doing that as well. Finally, I want to let y'all know that Sunday is Mother's Day. Sunday is Mother's Day. Do not forget Mother's Day. My mom, if she's listening, Lynette Collins, I love you. See you on Mother's Day. And I'm blessed to be able to say that, and everybody doesn't have that blessing. I heard someone earlier say that they've been so busy that, the holiday escaped them, and that's something that can really happen. If you're working in this, if you're in the throes of either unemployment, or trying to get resources, or trying to find out information, or look for a job, or whatever, some of the things that we have traditionally held strong to can seem just so far away. But celebrate our mothers, celebrate our families. I don't want you to forget that. On behalf of Governor Cooper, we want you to be physically distanced but not socially isolated. We're going to get through this, and the governor said we're going to get through this only if we stick together. And the only way to do that is we got to stay connected. So thank you all for your time. If you have any other issues or questions that you want to raise to us, you can, of course, contact us at the governor's website, governor.nc.gov. And you can also visit nc.gov/COVID-19 to remain updated on information and resources that we have available at the state level. Thank you so much for your time.